you're the provider trying to help, there's this really complex layer, often hidden, health insurance.
Yeah.
And specifically, that first absolutely critical step, just confirming someone's coverage is actually good before anything happens. For hospitals, clinics, doctors, well, this insurance verification, it's not just paperwork. It can be a major headache. Honestly, it can be kind of make or break for a patient's whole financial picture. So today in this deep dive, our mission is really to pull back the curtain on, the essential steps. Confirming health coverage. We want to look at why it's just so critical. For patients, yes, but also for providers. And maybe uncover a few surprising things along the way. I mean, think about it. Have you ever got one of those medical bills that just made your head spin? Totally confusing. Ever wonder what was really going on behind the scenes there? Well, we're going to unpack that.
It's so true. And, before we even jump into the how of verification, it's really, really vital to get the why. This is way more than just ticking boxes on a form, checking coverage up front. That's your first line of defense against claim denials. Those are incredibly frustrating and a huge drain on resources.
Oh, massive.
Exactly.
Yeah.
And it directly stops patients getting, wrongly billed for things they thought were covered.
Yeah.
And honestly, it just makes the whole healthcare journey smoother, more predictable. For everyone. Without doing that check first, you're sort of flying blind.
That's a really strong point. It just shows how much actually hangs on this initial step. Because look, what we're talking about here directly impacts you, the listener, the patient. Just understanding this process, even sort of broadly, can genuinely save you from those horrible surprises when a bill shows up. It helps to make sure you get the care you need without hitting, unexpected money problems. I actually read somewhere that a huge chunk of initial claim denials, they're just because eligibility wasn't verified or the policy wasn't active. It's like the cornerstone, really. So, okay, if that's the big why, where do providers even start trying to sort this out? What are the absolute core checks, the ones that really decide if billing goes smoothly or not?
Right. So the very first thing, and it might sound super obvious, but it's missed surprisingly often, is verifying policy activation.
Activation.
Yeah. Think of it like maybe a new streaming subscription. You might have signed up, but if the start date hasn't hit yet.
Nope.
Exactly. No access. Health insurance policies have very specific effective dates. So it's crucial, absolutely crucial, to make sure the patient's insurance is active on the specific day they get the service.
Mm-hmm.
We've definitely seen cases where, say, someone's new insurance starts June 1st, but they went to the doctor on May 31st.
Oh, boy.
Yeah. Leads to a full unexpected bill. Not fun.
Okay, so policy activation first. But even if the policy is active, that's not the whole story, is it?
Yeah.
What about the patient's actual status? Are there, tricky situations where the policies live, but the patient isn't covered right then?
Precisely. That leads straight into step 2.
Uh-huh.
You've got to verify the patient's enrollment status. This is super important, especially if it's insurance through work or an individual plan they bought themselves.
Right.
You need to confirm their coverage is really active for them, meaning it's not in a grace period.
What's a grace period, exactly?
It's that short window after maybe a missed payment. Coverage might technically still be on, but it's shaky, very tenuous. Or worse, it might elapse completely. So an active policy doesn't automatically mean active enrollment for that person on that specific day. It's a really key difference. Then after that, we move on to step 3. Checking coverage limits and exclusions.
Ah, the fine print.
Exactly. This is where it can get really, really detailed. It's not just a simple yes or no on coverage. It's more like, okay, what isn't covered? Or are there limits?
Mm-hmm.
A lot of people just assume, I have insurance, so everything's covered. Big misconception.
Yeah, I can see that.
For instance, maybe elective surgeries aren't covered, or certain mental health services might be excluded in some plans. Or you might have annual limits, only so many physical therapy visits per year, for example.
Oh.
Or caps on prescription drug coverage. You have to know about those. I remember this one case, a patient thought their cosmetic surgery was covered. Elective, turned out. Explicitly excluded in their plan.
Yeah.
Seeing the bill. Oh, it was just heartbreaking for them.
Yeah. That's such a critical point. It's not just, am I insured? But does my insurance cover the specific thing I need? Okay, so once you've confirmed general coverage, what's the next level down? Checking the actual service.
Yes, spot on. That takes us to step 4. Confirming the specific medical services the patient needs are actually covered by their plan, even if the policy is active, patient's enrolled. If that specific procedure code, maybe it's a particular blood test or a complex surgery code, isn't on their plan's approved list.
No reimbursement.
None. The insurer just won't pay. So this needs really precise understanding of both the medical procedure and the policy's nitty-gritty details. And fifth, and this is really important for the patient experience, it's checking their out-of-pocket costs.
Right, like copays and deductibles.
Exactly. Copays, that fixed amount you pay each time, maybe $20, $50. And deductibles, that bigger chunk you have to pay yourself before the insurance really starts covering major things.
Yeah.
These need to be verified right at the start. Knowing what the patient will actually owe personally, it avoids so much confusion, financial stress, arguments later on.
Yeah, setting expectations.
Totally. It's all about clear expectations from the get-go.
Okay, that makes sense. What about those procedural hurdles? Like needing approval before a treatment. How does that fit in?
Ah, yes. Step 6, checking pre-authorization requirements. This one's a biggie.
Pre-auth. Heard that term before?
Yep. Some treatments, certain procedures, even specific expensive medications often need the insurer's green light before you get the service. Prior approval. If you don't get that pre-auth, the claim might just be denied outright.
Ouch. Leaving the patient with the whole bill.
Potentially, yes. It's a really critical administrative step, and honestly, it can really slow down getting care if it's not handled right. And then finally, step 7, checking the provider network status.
In-network versus out-of-network.
Exactly. Most insurance plans have specific networks, lists of doctors, hospitals, specialists they've contracted with. So it's absolutely vital to check if the doctor they're seeing, the hospital they're going to, is in the patient's network. Because going out of network, that can mean drastically higher costs for the patient.
Like significantly more.
Oh yeah, hundreds, sometimes thousands of dollars more. Because the insurance company pays way less, or sometimes nothing at all, for out-of-network care.
Wow. Okay, so those are the 7 key checks happening, kind of behind the curtain. But how does this actually happen? How do providers get this info? What tools do they use? And then what are the biggest roadblocks they run into doing this every day?
Well, there are a few main ways they do it. Increasingly, providers use electronic systems. Often these are linked right into their electronic health record software, checking eligibility pretty much in real time.
That sounds efficient.
It can be,
Yeah.
but sometimes you still need to make direct phone calls to the insurance company, especially for like complicated cases or verifying very specific services. That takes time. Or sometimes they can check patient portals online if the insurer offers a good one. But yeah, even with those tools, it's definitely not always easy. The single biggest challenge, insurance plans are just incredibly complex. Seriously.
Right.
Constantly changing. New plans, different rules, endless variations, even within the same insurance company. It's a maze. And then you add in simple errors. Incorrect patient information.
Like typos.
Simple typos in a name, an old address, even getting the birth date wrong. That can cause frustrating delays. Really gum up the works, and sometimes for days. It really makes you wonder, with all this complexity, how many people just avoid getting care because they're terrified of that surprise bill? It's a huge administrative weight.
Yeah. So, putting it all together, what does this mean for us, for patients, for providers? It seems like despite all these challenges, the potential for delays, the confusion, doing this verification work up front is fundamentally about making sure patients get the care they need without those awful, jarring financial shocks later. It boils down to transparency, doesn't it? Setting the stage right from that first interaction. So to kind of wrap up our deep dive here today, the main takeaway feels pretty clear. This proactive insurance verification, really digging into the policy details, what services are covered, what the patient might owe, and doing it before treatment starts is just absolutely key. Key to avoiding problems, making billing smoother for everybody. It's this essential, often invisible part of good healthcare that really shapes the whole patient experience.
And, this brings up a really important question, I think. When you consider all this administrative work, often unseen, that really allows us to access healthcare that feels seamless. And you think about how this very first step, this verification process, really shapes that entire patient journey from the moment you book an appointment right through to getting that final bill. How might things change? How might people access and really experience care differently if this whole system was more streamlined, more transparent? It's something to think about. It's probably far more impactful than most of us realize.
If you are looking for outsourcing services, schedule a demo today by visiting www.staffingly.com.